too.
Goes around.
Oh, that's the back, right?
All right, yeah. So let's just look at these hearts for a minute. Figure out what we're seeing. I cleared out the fat. There's a lot of fat on the vessels, and it makes it a little difficult to tell what you're seeing. So these 4 hearts all have this area cleared out. So you can see this vessel right here, this one, and the other arching one. There's sort of 2 arching vessels that we see. The big one on top, that's your aorta, right?
Mm-hmm.
And this was the one going to the lungs. This is the pulmonary trunk that would branch into the pulmonary arteries.
That's the front of the heart.
So this is the front. So when you see these 2 nice arching vessels, you should probably see a diagonal line, although there's often fat running with it, but there's a vessel that runs across the heart in a diagonal. That's sort of an indication that you're seeing the front. If you look at the back, it's going to be different. You should see more of a vertical line, if you can see that at all. And you can see the back of those big arching vessels, but that looks different. So I always look for that pulmonary trunk. Yeah. And here's the model. So that's what we're seeing. We're seeing that pulmonary trunk, that aorta. So that hopefully will help you with orientation, knowing what's what. We have the coronary sinus. We'll do the vessels. So coronary sinus is a small vein that sits in the back groove here. So it's deep in that groove. It's embedded. But that is the coronary sinus. I sort of have to pull that open to see it. But it's an important vessel. That all of these veins from the heart muscle itself connect to that. That's the coronary sinus on the back side, sitting in that groove which is a sulcus. So it's deep in that groove. The bigger hearts are going to show it a little bit better.
So will you have a big heart and a small heart out on the exam?
Yeah, and it will depend on the cow heart that I bring in, but if it shows up a lot better on that, I'll use it. But I have my probe in it, but can you see that coronary sinus here? It's that vessel right there. All right, aorta we have on our other list, but you can also see on the hearts that was the brachiocephalic. Pulmonary trunk right there. Aorta, great big artery. Now you will see one of the first arteries that come off of aorta, which is the brachiocephalic trunk or brachiocephalic artery. But the aorta is super, super thick.
Big one.
Yeah, big opening, big lumen, and really thick walled. So on this one, this is aorta. Brachiocephalic artery is the first artery that branches off of aorta. So this would be brachiocephalic. This would be brachiocephalic. Here in a little guy, you can see aorta here and the brachiocephalic. Then we have pulmonary trunk, which is that other arching one here. So pulmonary trunk right here. So on all of the hearts you can see pulmonary trunk. You do have on your other list that remnant artery, also called ligamentum arteriosum, and that's best to see on these big hearts. And so that is this little ligament right here that connects the pulmonary trunk with the aortic arch.
Will you take either of those names for that one?
Yes, you can call it ligamentum arteriosum or you can call it remnant artery. I'll take either one. All right, back to our list. Fossa ovalis. You have to see inside the atria and the so let's first just look at the atria and the ventricles. So the 2 small chambers that sit on top of the heart, these are atria. One is an atrium, so singular or plural is fine. Right atrium, left atrium. The big chambers here are ventricles. So if you look on the inside, they're hollow, and blood would sit in those cavities. To see the fossa ovalis, that takes a little work. So that's something I'm going to have to show you one-on-one when I can find a good one. So let's come back to that. It's in the wall.
You showed us last time, the hole that goes to aorta?
Yeah, but it's not a hole anymore. Once you breathe, it closes. Auricles. So these entire chambers are atria, but that fringe sort of edge that looks like an ear flap that edge is an auricle.
Like if you pin down the bottom part, that would be auricle?
Yeah. So if I asked you to name this, the edge here, the structure along that edge. But if you're not sure on the test, just ask if I want you to name the entire chamber or just the edge of it.
I don't see Oracle on the list. Is there another name?
It's
right
I always spelled different.
Yeah, auricle is the name for this. It can be called pinna or auricle.
Okay.
And so it really does, they named it after the ear. It's supposed to look like a ear flap.
Sorry. Watch the video.
Intraatrial septum is the wall between the atria. So wherever we can get into the atria and find the wall where they connect, it depends on where it's cut. If I can get to that wall. But you got to get your hands in there. But that wall there between the two atria is the intraatrial septum. And if we can see a depression in there, that would be the fossa ovalis. So it takes a little bit of work to get that view. But intraatrial septum. And then the ventricles, of course, are the big chambers down here. The interventricular septum. I'm going to turn this down. This got cut a bunch. So these chambers here are ventricles. This big wall, the meaty wall here in between the two, that'd be interventricular septum. Muscles on the interior parts of the chambers, we have pectinate muscles. Those are the ones inside the atria. So open up one of the atrium, and you will see these. I know it's dark. Let's see if I can get my hands out of the way. You can see those ridges, those sort of struts, part of the ceiling. Those are pectinate muscles. Here's one that I've cut into, so you can see all those ridges. Those are pectinate muscles inside the atria. Then we have the valves. So when you're on the right side of the heart, this is our right ventricle, this would be our left ventricle. You see the flaps of tissue between the atria and the ventricle. So that flap here, there's 3 on this side, although of course we're only seeing part of 2 because it's cut. But that is a tricuspid valve. And on the other side, the left side of the heart, those flaps that we would see here, that's a bicuspid valve. So 2 flaps would come together to close that off. On this side, there would be 3 flaps, tricuspid, that would come together to close it off. When you look at these valves, you'll see that they're held in place by these strings. Those are chordae tendineae. Not everyone says it quite right, but chordae tendineae, whatever you learned it as, that's fine. It's cord tendons, just make it sound Latin. All right, and then the chordae tendineae will attach to the papillary muscles, and those are just the extension of the muscle wall that stick up. So wherever there are the chordae tendineae attached to the muscle wall, that is a papillary muscle. Some of them look more distinct than others. Some of them really do look nipple-like, which is what they're named for, but not all of them. So like this right here would be a nice big papillary muscle, and you can see all the chordae tendineae attached to that papillary muscle there. And then we have another muscle feature, the trabeculae carni. So when you look inside the ventricle, it also has ridges in the wall, just like in the atria there were ridges called the pectinate muscles, but in the ventricles, these ridges are going to be called trabeculae carni. So that's what those are. And then we have the semilunar valves. Those are going to be the valves that connect the ventricles with either the pulmonary trunk or the aorta. So you got to get in on the right side between the right ventricle and the pulmonary trunk. You should see a pulmonary semilunar valve. It depends on how it's cut, how well we can see this. But right here is where that vessel starts, so that should be where the valve is. And these valves are just loose flaps of tissue. There should be 3 little loose flaps. Here's one of the cusps. Here's another one. And there should be a 3rd one right there. So that loose tissue there is a pulmonary semilunar valve. And then to find the aortic semilunar valve, we've got to get into the ventricle, the left ventricle, and go up. It takes a little bit of work to get to where it is, but there would be 3 loose flaps. That would be the aortic semilunar valve. If I put my probe in the aorta, it would come out there, and I can get the flaps right there. So that is aortic semilunar valve here, here, sorry guys, is the pulmonary. So I'll put my probe in the pulmonary trunk, and I can stick it into that opening, and I can grab the flap there. So
That would be what?
this is pulmonary semilunar valve. It's going to the pulmonary trunk.
Okay.
And so the aortic is the one that goes to the aorta. 2 semilunar valves.
Okay, can you stick your probe in both of them, like back and forth, like we just did?
Yeah, let me show you on here too, because it might help you visualize what you're seeing. Of course, it's always easier on the hard plastic model, but here's that pulmonary trunk, and we're on the right ventricle side. If I'm just grabbing 3 loose flaps, but that's what it would sort of look like. That's pulmonary semilunar valve. You can see they're sort of half moon shaped. And then in the left ventricle, this would be the entry into the aorta. So those 3 bits of tissue, that's the aortic semilunar valve. You can see how deep they are and sort of difficult to get to. So you just have to figure out which side you're on and what vessel you're going into. You wanted me to do them on the heart again?
Yeah.
I'm just going to list them. Alright, so I'm putting my probe in the pulmonary trunk, going backwards into the right ventricle. Can you see that little flap right there? Sort of need an extra hand. Oop, I just went right through the valve. So these loose flaps, those are pulmonary semilunar valve. Those flaps make the pulmonary semilunar valve. Atria, aorta, I'm going to put my probe in the aorta.
That should come out on the right.
So left, aorta left. So those 3 loose valves, those flaps, those are aortic semilunar valve that I'm wiggling around. Aortic there, pulmonary up in here. That's it, that loose tissue right there. Doesn't look like much, but that's what we're hearing when you listen to the heartbeats, those flaps hitting each other from the force of the blood flow. All right, that's everything on your list.